Hi, my name is Kelly Emerson, and I would like to talk to you about the prevalence of medical errors that occur in our nation's healthcare system. In 1999, the Quality of Healthcare in America Committee at the Institute of Medicine released a report, "To Err is Human, Building a Safer Health System." This committee revealed that as many as 98,000 patients die in hospitals as a result of medical errors. Errors from delayed treatment, adverse drug events, mistakes in blood transfusions, surgical injuries, improper use of restraints, falls, burns, pressure ulcers, the list goes on. This shocking revelation spurred the nation into action because the very industry that was designed to help heal our patients was in fact hurting them. Regulatory agencies, special interest groups, professional organizations, and healthcare institutions jumped on the bandwagon to improve care. After the release of the Institute of Medicine's report, other agencies followed with recommendations for improving healthcare. The IHI, or Institute for Healthcare Improvement, published a set of guidelines in December 2004. This plan was very specific and established guidelines based on evidence-based practice. The IHI exceeded its goal in 18 months. They saved 122,300 lives. The nationwide efforts resulted in improvement in about 60% of the safety measures set forth. According to the Institute for Healthcare Improvement, every year there are an estimated 440,000 deaths as a result of medical errors. It is the third leading cause of death in the nation. Medicare patients have a 13.5% rate of harm. Of those patients harmed, 44% were preventable. The total cost to our nation, as much as $1 trillion. Medical errors have consequences ranging from minor or temporary harm to death. 10 to 12% of patients in the hospitals experience harm. 4.65 injuries per 100 hospitalizations. Often they resulted in preventable deaths. This caused emotional trauma, not only for the patient and their families, but also for the healthcare provider who committed the error. There is also an economic burden associated with medical error. There's the obvious burden to the patient and their families as the illness is extended because of the medical error. There's also the economic burden that the organization faces as they lose reimbursement for an injury or error that has occurred. And then there's the burden nationally as healthcare costs skyrocket. If we do not continue to make strides in reducing patient errors, the entire healthcare industry will suffer. Reimbursement from the Centers for Medicare and Medicaid Services, as well as private insurance companies, will be greatly reduced. Public confidence will be shattered. Fewer people will seek out appropriate healthcare resources. The number of people entering the profession will drop. Those remaining will suffer stress, anxiety, burnout, and loss of confidence in their abilities. The Joint Commission provides a list for those medical facilities that seek accreditation. Every year, a panel of experts identify emerging patient safety trends, and the Joint Commission chooses the highest priority issues. The National Patient Safety Goals were originally established to help organizations address areas of concern regarding patient safety. There are many organizations that study, identify, research, and propose solutions for ensuring patient safety. They pass regulations, create policies, and monitor best practices, but this is still not enough. The National Patient Safety Foundation published a list of recommendations in 2016 identifying 8 methods to accelerate improvements in patient safety. This list was much broader than the previous lists, which were very prescriptive and very detailed and promoted clinical bundles and things based on evidence-based practice. This was a broader culture that we needed to have in order to reach more people. The first thing that they recommended were that leaders promote a culture of safety. Without a culture of safety, there's no way to identify and define those areas that really need to be looked at. They asked that we implement a coordinated oversight. Regulatory agencies and hospitals should get together. Studies should be done. Design valid safety metrics that are meaningful. Promote funding for patient safety research. Without the funds, there's no way we can come up with the best evidence-based practice to promote safety. Apply safety measures across the continuum of healthcare. That means every area, not just the hospitals, but all area, doctors' offices, nursing homes, etc. And to support the healthcare providers in their ability to provide excellent care. And collaborate with patients and families to provide the care. Tell them to say, you need to wash your hands when you come in my room. That's not a medication I'm used to giving. Tell me what you're giving me. And finally, utilize technology to optimize patient safety. Things such as barcode scanners for administering patient medications. This ensures that you correctly identify the patient and that you barcode scan the medication so that you know that you're giving the medication to the right patient. I believe the most important solution is creating a culture of safety. Without a culture of safety, the other interventions would be ineffective. It's important that we set up expectations and we embrace that culture. Leaders need to walk the talk, make patient safety rounds, round on the units, and listen. We need to alleviate the individual's reluctance to report errors, safety concerns, and near misses. We also need to employ a just culture. This would encourage employees to speak up. There would be a free flow of communication. We need to prevent and stop intimidation and use a non-punitive approach to error reporting. Another important area is safe staffing. A lot of hospitals have instituted fatigue policies and staffing committees to ensure safe staffing and to ensure that the care provider is not too tired to take care of the patient safely. We also need to encourage employees to call safe harbor when things are unsafe and when the staffing is not good enough to support the patient load. And most importantly, we need to empower every voice, healthcare providers, patients, and their families, because if everyone's looking for safety issues, we all win. And finally, we should celebrate our successes, because those things that get rewarded get repeated. This is a key element in leadership. So why is embracing a culture of safety important? Well, 6 out of 7 events are unreported. Staff are more likely to speak up in a supportive environment. And you have to admit there is a problem before you can divine and commit appropriate resources for the solution. And it's difficult to do that if the staff are afraid to report. The goal should be focused on identifying trends and developing and implementing evidence-based practice safety intervention. Many believe that a transformational leadership style would be the best in developing a culture of safety, because leaders influence and create goals for healthcare organizations. They must operate within the guidelines of regulatory agencies and establish policies and procedures and hold individuals accountable for achieving these goals. And while that's extremely important, I believe that the characteristics of a servant leader are even more important, because we want to support our employees. We want our focus to be on the employees, because if we focus on them and listen with empathy, nurture and provide a supportive and healing environment, we can establish a trust and open lines of communication so that they feel comfortable telling us about the errors that happened and the error that could potentially happen. So we need to establish those lines of communication. We also want to inspire and lead by example and have non-punitive error reporting. If they're afraid to report, they're not going to, and we'll never be able to identify those areas that we still need to work on. Many hospitals develop unit practice councils. These councils would be extremely important in knowing what happens at the bedside. They're the ones that can identify what's going on and what could be improved so that we can deliver safer care. We must have a culture of safety to build on. Only then can we create a healthcare environment free from harm. Thank you for your time. And please take a moment to thank a healthcare provider.